That's unacceptable in my book, and that's why something needs to be done. The costs, I think it's pretty straightforward. Read the numbers on the blue side for this one. This is the gross national product. It's gone from about $1 trillion in 1970, a little less, 800 million, up to nearly 12 or 13 billion today. We all know that, and that's the basis of inflation. It's gone up 12 times in 30-odd years. This is the health system. It started off in 1970 at 70 billion. Today, it's at 2.3 trillion. That's a rise of 33-fold in that same period of time. Whereas other countries in the world that have a different system have seen the standard 1 to 2% a year that the first line shows. In this country, our health costs have gone up at a rate 3 times that which the GDP has gone. And then, as you see the terms coming together, it's not going to take long before the whole GDP is paid for by health services if we don't change that. And that, of course, is unacceptable. Now, I want to get through this slide very quickly, and I'm going to just put them up fast, because there are myths out there that say it's going to cost money if we expand access to the 70 million or 50 million who are unemployed or uninsured. It's going to cost money if we try to improve quality, because everybody knows that to pay more to get better quality is going to cost more. And the same is true with access and quality. Those are all wrong. Don't believe when people tell you you need more money to provide more care. It's not true. We provide care in this country in the most inefficient, irresponsible, outrageously inappropriate ways. It's not appropriate for people without insurance to be served as primary care in the emergency room. At $1,000 a pop, you can get a lot better primary care if you could pay for it in your primary care office. Every country in the world that has a universal health system provides care to 100% of the people living in that country, provide that care for half per capita of what we are today. So that should imply that increasing health to everyone will in fact lower cost, because it can all be done more efficiently, more effectively, less redundancy. The same is true with quality. I've shown you the quality statistics. How is it that countries that provide 100% quality to their population have better outcomes and better quality? Because the system is run efficiently and effectively. And that's what would happen if we went through this. And if we talk about what are the goals that we want to have in a system, clearly access to quality care has got to be everyone's goals. I know there are people who say, well, if they're poor and they're not working, then they have to just fend for themselves. I don't believe that. It seems to me that everyone in this country, probably the greatest country in the world for all kinds of reasons, should have the right to have health care. We also know, and this is the thing that drives the medical group, the medical practitioners crazy, is they don't feel, for most cases, that they're getting an adequate reimbursement. You talk to people in primary care. Some of them can't take home a paycheck for themselves. They have to pay all their workers, and then they have to pay the rent and their insurance, and they don't take home a paycheck. That's not appropriate. It's not acceptable. We clearly have to control costs, and I think we talked about that. This is the one that is most distressing about this country today. And that is that I would think everyone here, and almost anyone that you would ask, would say, yes, if I go to the doctor, I know, or I think I know, or I trust my doctor to take care of me first and put my needs as a patient before his needs. That's not true today. That's not true. Profits, self-interest, and greed are now part of the health system for reasons that are not because doctors and providers are bad people. It's because our system has focused on that under the basis of the medical system is a part of the business, it's just an economic system, and we know that, according to Adam Smith, profits, self-interest, and greed drive the capitalistic system. Why did we get where we are today in this country? Because of capitalism. Because people were willing to go out and take a risk, hoping to make a profit. That's the engine of capitalism. That's a good thing. It's the heart of the market, is competition, without question. However, these forces today operate in the insurance industry that sells most of this insurance. Not most of us. I look at the group here, I would say most of us probably are on a federal program. But at least those who are working and have employee-based insurance, the insurance industry is making a profit. They have to make a profit because they sell stock to stockholders, and the rule in this country is if you have stockholders, you must pay them a dividend or show profits. That's the rule. So they're not bad, they're just doing what the system tells them to do. Clearly the pharmaceutical industry, the hospital industry. And now we know that there are specialists in medicine, and there are specialty medical hospitals whose interest is in making money from the system. That, to me, is a little bit beyond the pale. And it's beyond the pale because, hang on, let me go back. I hit the wrong button. Come on, buddy. Because medicine's it's not a marketplace. You can go down to Camelback or here in Bell, and you can walk between car companies and kick the wheels and decide you like this color or that one, you like that engine or that one. You know what you're buying, and you can buy it. And you have a certain distrust with the person you're buying it from, because you know this is a market. These guys are out to sell vehicles, and it's certainly true if you want a second-hand vehicle. You know, it's the old story. But that's not true in medicine. We are there to practice and prescribe for the good of people and to do no harm. And the medical professions are not shopkeepers. We don't compete with each other. We shouldn't be. We should be doing things to put the patient's needs first. That is something that is being changed in our system. So whereas the invisible hand of Adam Smith promotes self-interest and greed, and does so in order to improve the society. I mean, that's a good thing. We have gotten where we are today because of people like Edison and Bell and others who have, you know, and Microsoft and Apple Computer, people who are willing to take a risk, put themselves on the line, and have made a lot of money as a result of it. But none of those things in medicine should have a role. And let me go forward. And the reason we can, but the question then becomes, how do we escape this market trap that we have fallen into? How do we escape the situation where our system is taking resources from all of us in order to make others profitable and possibly hurting us in the process? And we all know of cases of people who have been denied care and thrown out of the hospital and so on. Well, the Conyers bill, I believe, will do that, and it's very simple. It is a bill that provides public financing. It assures private care. In other words, you go to the doctor you want to go to. The private doctors, the private hospitals will be maintained and promoted in the system. And it will cover everything, universal coverage.